Uyo. Thank you so much for joining us this morning, Prof. Well, how the
Thank you,
government is going to
Chamberlain.
roll
Good
out,
morning.
yes, how the vaccines is going to be rolled out, the administration, the modalities, clearly those things are some of your concerns as well. I mean, one that was I found very, very interesting actually is the fact that you were equally concerned. I'm wondering why people needed to register. I don't know. Has your position changed on any of these concerns that you have raised hitherto?
Well, thank you very much, Chamberlain. Let me just say that we are happy that the vaccines have eventually come and that Nigerians are going to have access to the COVID-19 vaccine. The preparation had been on. What we had said, and it's not peculiar to this vaccine, is that we have to implement our policies in the way that we all will appreciate. And that means that the right thing should be done. Let there be some level, in fact, not level, some coordination, because one of the problems we have is coordination. If there is coordination and it is stated as in the policy, then there will be minimal concerns. I mean, there will be minimal problems. But where it becomes chaotic and everybody does whatever he wants to do, and also the fact that it should not be diverted to anybody. We have a cycle, we have cycles of administration, and that is the health workers first. The second is those who are 60 and above. The third is those who have comorbidities. Like we have said severally, hypertension, diabetes, renal conditions, and cancers. So if we are able to do this effectively with clear monitoring and documentation, I believe that this will be one area that we have learned some lessons from the mistakes of the past, particularly areas of Ebola in 2014. There were no the documentations were not as we expect. So documentation is important. Once we have this done, then that we probably were right. But the issue of registration, I had to inquire, after a discussion on channels, why do we have to register? And I was told that it's part of learning or a part of documentation. They want to see how many people will register, and others who could not register will be assisted. So in that wise, well, I say, well, this is one area that we probably will need to put our documents in place. If we can document and use this, I mean, as experience of the administration of COVID-19 vaccine, then we would have done a lot. Because at the end of it all, we will need to compare with the experiences of other countries, and we need to have this experience. We need to know who has been vaccinated. We need to know who has one side effect or the other, we at the end of the day, we should be able to say clearly that yes, we have vaccines, we have had vaccines, we have administered vaccines. These are our experiences. These are the number of people that are being vaccinated. And then, of course, that is the beginning of monitoring. We need to then monitor over the time to find out of those who had vaccines, how many of them still had COVID, because that is important, and that is where we'll be recording what we call efficacy. So if we are able to get that the issue of vaccine, there are two components. There are two issues, sorry. One is the efficacy, two is the safety. And we have to put everything in place to monitor the efficacy and the safety. Because at the end of it all, we must come back to disseminate these findings and say, well, this is how much we have done. This is the level of efficacy. This is the safety measures, I mean, the safety of the vaccines. And then we compare it with other international communities.
Okay.
In that case, Nigeria would have achieved something from COVID-19.
Yeah, Prof, I'm sure we'll get to the issue of safety and efficacy in a bit, but talking about the administration and the modalities that you talked about, given the comment and position of the federal government over time that the structures of the NPHCDA is what is going to be used? Aren't you comfortable that the NPHCDA has enough structures to address some of the concerns of administration and modalities that you're talking about?
Well, it is true. I mean, there's no doubt that MPHCDA has done well in area of polio and other preventable, vaccine-preventable diseases. And we expect that they would carry out this without any, with minimal issues. But again, we need to put ourselves in place. We must be prepared, because let us not just be ambivalent on the issue of, yes, we have MPHCDA, they have done this before, they do it well. The essence is to ensure that if we are able to situate ourselves well, then MPHCDA should be able to do this. They have the experience, and they have, they have deployed their emergency operations centers effectively, and incident management centers. So we will expect that there will be minimal issues, but you all know the other we don't have, they don't have ambulance, vehicles, no vehicles to move the vaccines from one place to the other, or all those that are participating, they are not even paid their daily tour allowance. And one of the issues that is in place now is that the health workers are not being paid their hazard allowance, and that becomes a problem. We don't want any issue that will truncate this process. The doctors, other health workers have not been paid their hazard allowance, and this may become an issue later. And we should nip it in the bud. There is some disquiet, and I'm advising the Federal Ministry of Health that they should quickly respond to this, put this in place, so that it does not, this does not truncate the process that have been put in place by federal government. They spend so much money to ensure that Nigerians get the vaccine, and the Nigerians should get the vaccines without undue interruption. One of the areas that I see is if the hazard allowance issue has not been put in place or is not being paid, then there'll be a problem. But I can assure you that the Nigerian doctors are very committed to this cause, and we will support the government in whatever way we can. But I also want the Federal Ministry of Health to do its own bit, because the Federal Ministry of Health is the organ. The NPHCDA is under the Federal Ministry of Health, and ensure that these things are monitored so that no individual will use it to his own advantage. You all know what I'm talking about. We need to monitor, we need to supervise. People need to be motivated. People need to be paid what is their due. And Nigerians should get the services that they deserve.
Prof, concerning the hazard allowance which you referenced, are you saying there are some doctors or health workers at large who have not received hazard allowances? Because I thought that issue was sorted months ago. So what is the state of hazard allowances for doctors, health workers generally?
Well, Chamberlain, I'm surprised that they are not aware that the hazard allowance that was negotiated stopped after 3 months. So if we look at that, get back in August or so, from May, it was paid April, May, and June. From July to date, what is being paid to doctors and other health workers is 5,000 naira a month. And we have discussed this severally. The federal government has kept quiet. Federal Ministry of Health has not said anything. The Federal Ministry of Labor is quiet about this. And I don't want a situation where there is disruption. And if we don't want any disruption, then we must be proactive. If we have to be proactive, then we need to pay the hazard allowance. Even if new ones are not negotiated, the one that was negotiated should continually be paid. The feeling was that the COVID-19 was going to go off in December. That was the thinking. And you see, that was not scientific, as you can see now, that we are now back to the trenches again. So we do not want any situation to disrupt the commitment of the doctors and health workers. It is most appropriate for agencies of government to do the needful, because I don't think the president will be happy if this investment is disrupted, and
Right.
it should not be disrupted. And if it's not to be disrupted, then the Federal Ministry of Health should do what it should do and pay all health workers the allowances that is their due. Nigerian health workers are showing uncommon commitment to this cause, and no individual or group of individuals should disrupt the good intentions of government. I believe that the Mr. President will not be happy if this process is interrupted because somebody is not doing what he's supposed to do. So
Right.
this is my advice, and you can see we are early in this process to advise the Federal Minister of Health to do the needful.
Right. So, I mean, it's disheartening to see that we're back at this hazard allowance again. But Kayode here, by the way, Chamberlain, will be speaking to you in a moment. But to what extent, really, can this non-payment of hazard allowance disrupt the vaccine rollout? Just help paint a picture for us.
Well, ordinarily it should not, but it will if there is not early intervention. I mean, we're talking about people putting themselves on online for Nigeria. It's like putting yourself on a death row. Many of us have died. Many of our colleagues have died. Both doctors and other health workers have died in the process of providing service to his nation, which is a good thing to do. So they pay the spring price. But in doing so, we need to do what we should do. For instance, apart from the fact that the hazard allowance have not been paid, the life insurance issue that we talked about has now gone to sleep. And when people begin to wake it up in a way that probably is not appropriate, people will just say that doctors have come again. I mean, why do we have to then go back and forth, and say, and people are not doing what they should do? Will you blame the president for this? Will you blame the president that life insurance cover has not been given to doctors and other health workers in this precarious situation we find ourselves? Will you blame the Mr. President that have not been paid? Some people are not doing what they should do, and they should do it. Because, you see, we know that hazard allowance is not a replacement for life. But you see, there's what we call motivating factors. People have to be given some incentive to do the work. Let them show commitment. Let them show more commitment. And like I said, the Nigerian doctors are very, very, very committed. And that's why, despite all these obstacles that we find ourselves, they are still working. But they are grumbling.
Right.
They are working and they are grumbling.
The question
and we
will
shouldn't allow this grumbling to come to the open.
Right. So the question will be, are the staff, that's the health workers with NPHCDA, who are primarily going to be involved in this vaccine rollout, are they also being owed the hazard allowances and other issues which you raised, like health insurance? Are they also affected?
Well, it is difficult for me to say. I'm not a paymaster. So it is difficult for me to say whether they are being paid. It will be unlikely if they are being paid. But I think there's what we call universal applicability. We should apply to everybody.
Right.
You see, the truth of the matter is that any doctor or any health worker that is seeing any patient now, that patient is likely to have COVID unless proven otherwise. And therefore, the issue of protection, and we talked about PPEs previously, and we are still talking about that there should be sustained provision of PPEs. But in addition to PPEs, people who are providing service should be covered with life insurance. They should also be paid as hazard allowance. And other allowances, in fact, what we call inconvenience allowance. Remember that hazard allowance is not the same as inconvenience allowance, because doctors, other health workers move to places where they should not. Ordinarily, they are displaced from their places, or they relocate because of the services they are providing for the country. And
Right.
I commend their effort. I commend their effort because it is not easy for a family person to leave his home to an area that is totally unfamiliar with, and provide service. And I think that the Federal Minister of Health should do his job. That is what I'm saying.
Yeah, you're absolutely spot on that. It's only fair to ensure that, I mean, these health workers who are putting, their lives on the line should get compensation as due. I'd also like us to talk about this vaccine, because I know you are head of NIMA, and I mean, you understand, this process. So NAFDAC is meant to have finished off with the, checking of the vaccine for safety, I believe, not for the efficacy. Are you aware of which NAFDAC is checked or has checked for safety or efficacy or both?
Well, unfortunately, I'm not aware. It should have been put out for us to see. The issue of safety, well, it is. I suppose that NAFDAC will bring out their data very quickly, because we must work with evidence. It's not enough for us to say we've done this and it is safe. No, we must see the evidence that it is. In fact, this is the number of people that were used. This is the outcome. We need to see it. Like you say rightly, we can't talk about the efficacy at the moment because it's too early to say. And you know that this is emergency authorization. Otherwise, like I had said earlier, it would have gone to gone for phase 3 clinical trials in Nigeria. But because of the emergency authorization, because of the urgency of need, this had to be waived from our own country. But NAFDAC will have to bring out figures and facts about the issue of safety that they probably have done. I don't have any doubt about NAFDAC, but we need to have evidence. It is evidence that is scientific, and these are not impressions. So we would want to see very quickly, and everybody has the right to know what has been the safety components of the vaccine that NAFDAC looked at. So in that case, we will have more confidence in what we are getting. And of course, Nigerians, we will be very willing to embrace the vaccines. I'm not saying that Nigerians are not willing, but the confidence is very important, because as you know, there have been series of controversies about vaccines, and people are usually very worried on taking vaccine. You remember the issue of polio that we talked about, which had to be sorted out by using traditional methods like traditional rulers and religious rulers before it was accepted and were able to eradicate polio, which was a good thing. So what I'm saying, in effect, is that NAFDAC should bring evidence of the outcome of what they did.
So I'm wondering, Prof, are you saying that there is insufficient confidence as we speak? You talked about a phase 3 trial. From what we understand, the AstraZeneca vaccines have already gone through a phase 3 trial. The NAFDAC DG says that what they're looking at is a pharmacological vigilance, I think, which will sometimes could be called a stage 4 of the vaccine. So if anybody should report any adverse effect, they would like to know about it. What are your thoughts on that? And why are you talking about confidence vis-a-vis a stage 3?
You see, the issue is that I remember as a researcher in the 90s, some drugs, some antibiotics were brought to the University of Jos, where I used to practice. And they said they've been tested in Lagos. And I said Lagos is not Jos. We also will have to carry out our clinical trials in Jos. And we did. So it's not an issue of vaccine only. The stage 3, the phase 3 that we're talking about, is a universal thing. It's not something that's manufactured today. But like I said, this has been waived because of the emergency nature of the COVID. And we agree with that. What we are saying is that, in fact, phase 3 will bring out the pharmacovigilance we are talking about. Phase 4 is just marketing of the product. Phase 4 is marketing of the product. Phase 3 is where we will have documentation of the safety and the effectiveness of the vaccine. So by and large, the issue of confidence, even where it is established, and you read the social media, many Nigerians do not believe that it is going to be effective. They are not even sure whether, in fact, it is a vaccine. So we need to build their confidence. We need to renew their confidence. Like I said, the issue of polio vaccine comes very easily to mind, where even when it was established, they say it was supposed to limit populations in Nigeria, particularly in the northern part of the country, and then other parts were also rejecting the vaccine. That's what we call vaccine hesitancy. So we have to continually build the confidence of Nigerians. Let's not assume that, because vaccine has come, everybody will want to take. No, people are very cautious about this. But it is we who
If I
should
get you right
build
then,
that
if I
confidence.
understand you, then what you're saying is that you're not quite happy that the health workers have been earmarked to take it first.
No. Of course, we're already on the front line. He who is down fears no fall. You see, even the virus itself, we are facing it squarely as health workers, doctors and health workers. So it is not issue of lack of confidence or that I'm unhappy. What we are saying is that like I said, in administering this vaccine, we must document, we must keep our records. Because in the end, we will do the analysis of the records. The number of people who had been vaccinated, the number of people who probably have suffered one side effect or the other, what we call the effect, the pharmacovigilance component, and any other incidental findings that probably will arise from this process. And that is what we are saying. So it's not an issue of the fact that we are unhappy. We are saying that the right things should be done. And doctors and other health workers are prepared to take the vaccine. We know that other people have taken the vaccine. But again, we have what we call idiosyncrasies. Idiosyncrasies where people react to an issue to the drugs that is unexpected. And all things probably will happen, but they should be documented. But because will be part of our experience as a nation.
Just a moment.
And we should share it with the international community.
Yeah. Prof, just a moment. The issue that you've just raised now, this idiosyncrasies and reactions, another leg in the conversation altogether, but we'll take that on when we come from this break. Please stay with us. Staying with us. Prof, you mentioned an issue of the idiosyncrasies of various people to this jab. I'm wondering two things. Number one, is this something that could have been identified, in previous data? And secondly, are we prepared for the idiosyncrasies just in case? Oh, dear. Well, Prof, can you hear me? Well, for now, we do not have Prof back. It would be good to find out if we can, get him back because, there are some videos that have made the rounds, about, when someone takes the medication and then something happens, and then you see all kinds of things. Perhaps some of those things that that one can react to. So, Prof, if you can hear me now, you talked about the idiosyncrasies of people. In other words, how people will react to the jabs when they take it too. So, first of all, is this something that we could have picked up from previous data before now? And secondly, are we prepared? Or how prepared are we for those idiosyncrasies? What kinds do you think could be?
Well, let me just say first, the issue of idiosyncrasies and side effects. Again, that is the value of stage 3, of the phase 3 trial. If we had opportunity, but for emergency authorization, we would document our own experience. What are the types of side effects we expect in giving these vaccines? Because we needed to document this, but we don't have that opportunity because of the emergency authorization. It's also true, but I just want to use Panadol as an example. Panadol is a drug that we take and we take it for granted. But you would know that Panadol can kill, or there'll be severe skin reaction from Panadol intake in some persons. But this is not a normal side effects that we are talking about. So this is what we call idiosyncrasy. If Panadol that we take and we take for granted, everybody will buy it over the counter, and one person will take it and then will have severe skin reaction, or will go into a state of shock, or will die. That is what we call idiosyncrasy. And it's not common, but it can happen. And therefore it becomes difficult to predict. What we would have been able to do clearly, if we had had opportunity of the phase 3 trial, is the meticulous documentation of side effects. Apart from the efficacy of the side effect, we have to document the side effects so that we have a band of side effects. And therefore, when patients go through and have these problems, any patient that has the problem, will have opportunity to discuss and also intervene very early. And that is where what is missing in the phase 3 trial that we have not been able to. It is true that probably they've done this in Europe and America, but we are operating in a different environment. Our genetic compositions are different, and our social circumstances are different. And that is the value of the phase 3 trial that we have. We don't have opportunity to do in this country. But we would take it that after there are some other Black people in the world that had taken it, and we have even Nigerians in the UK and the Euro and in the UK and the US who have taken this vaccine. So let's assume, let's take it that probably they are representing Nigeria, but it's not a representative sample if we have to do scientific study. But the reason why everybody is saying that we should go ahead to take it is because of the emergency situation and they call emergency authorization. Otherwise, even the FDA would not have approved it. But the circumstance we find ourselves, the situation we find ourselves, warrants the fact that we have to administer these vaccines. And that will reduce the morbidity and mortality associated with COVID-19. Again, you all know that the biology of COVID-19 is not completely known. Whatever we are doing now is an intervention that is probably immediate. A lot of studies will go on for years to study more of COVID-19. So whatever we are doing now is just palliative, I can say. Let it become palliative because we don't have sufficient time to even know, whether this is a lifelong immunity that it will, that our patients will have, or 2 years, 3 years. The experience is not there. So the truth of the matter is that our documentation will give us the experience. It will give us the evidence at the end of the day that we vaccinated this number of people. These are the people that were prevented or that do not have COVID-19 infection anymore. This is the number of people that had this type of side effect or the other. This is what we did once the side effects are reported. So this is what we call science. It is not about verbalization. We don't be talking about it. We must talk with facts. If whatever we're going to do must be documented. And even the cost per person, we should be able to know at the end of the day, how much does it cost to vaccinate one person in Nigeria? Because that is what is planning, that's what we call planning. And also extrapolate to the future and look into the future and see what we can do. Because it is not just this ceremony is going to be continued for some while. It may be prevented by National Primary Healthcare Development Agency. And therefore, we must start from the beginning. And I'm advising that we must document. We must keep records. Once we do this, we would have achieved a lot. And for the first time, Nigeria has nationally kept some form of records since February 27th, when COVID-19 was reported in Nigeria. At least we have seen some resemblance of record keeping. We are told every day the number of people who tested positive. But what is missing is that we are not even told how many were done before this number were positive. Maybe they have it in their archives, but we need to know, because that gives us the confidence of the credibility of the data that we have. And this data will be used to generate other policy plans for this country. And if this is starting with COVID, then I'm very happy with myself. And I'm sure Nigerian doctors and other health workers will be happy that we are generating data for planning, effective and credible data for planning. So in my opinion, we should continue this way. Idiosyncrasies reported, side effects reported. Thank you.
You have heard that the president and the vice president will be taking their jabs tomorrow on live TV. We also understand that members of the Nigeria Governors Forum have also indicated, they've also agreed, so to speak, to also take their jabs in front of live TV to build confidence in the masses. What effect do you think that this could actually have?
Well, let me just say that this is a very positive demonstration of leadership. And I wholeheartedly welcome this, because, you see, leadership is not about, it's more than just leading people. You demonstrate what you say, do what you say. And that is what the president has opted for, and the people, members of the National Assembly. Once they do this, you will find that everybody will fall over one another to also go and struggle to do this. If you recall, you look at WTO, Professor Kojewala, the way she ties her head tie now is what almost all women want to tie, because they believe in her, and they believe in her, whatever she does is good. So of this country would agree to take these vaccines, then Nigerians have no reason to doubt whatever they have said. And I think that the Nigerians will be prepared to take the vaccines without any hesitancy at all. And I think this is a welcome development in this country. And I want to use this opportunity on behalf of Nigerian doctors to thank Mr. President and the leadership of this country for agreeing and accepting to be vaccinated openly, so that everybody would renew his confidence in the vaccine and, of course, in healthcare system. Because, as you know, the healthcare delivery system in this country has gone very, very low. And if the president can help us, and by this process, to rebuild the confidence of Nigerians, I think that NMA will give me my award, actually, because I think that this is a great, great positive move of a leader, and a quality leader for that matter. Thank you.
All right, Prof, if I could just come in here. So we've spoken about research, right? You've spoken about data, rather, but before data, there needs to be some form of research to know what we're looking for in the first place. And you were in charge of NIMA for some time. Now, looking at NIMA's role in this fight against COVID-19, and especially in the area of vaccination, because by mandate, NIMA is meant to conduct research into diseases of public health importance in Nigeria and develop structures for the dissemination of research findings and provide an enabling environment. So NIMA, when you were there, and NIMA now, just how should NIMA have performed in this? Because for some people, they think NIMA is still playing catch-up.
Well, NIMA playing catch-up. The factors that surround that will probably have to be dissected. The truth of the matter is that what you say the mandate of NIMA is what it is. But the enabling circumstances are lacking. NIMA has a very, very good platform. It has built a capacity, human capacity, and equipment. You find that at the beginning of this pandemic, NIMA was all over the place, and it's still all over the place. But NIMA needs to be supported. You see, you cannot conduct research without money. It doesn't work. It's not any lip service. Research is a highly, highly capital-intensive project, and unfortunately, you have to, if you have opportunity to open to the budget of NIMA, you pity NIMA. So it is not enough to establish an institute and believe that money will come from somewhere. We need to invest in health and in health research. That is not seen in Nigeria. I have said it before, even when I was in NIMA, that even we do not value research. You see, the beauty about life is that you cannot invest in what you do not think, you do not value. And what I see in Nigeria is that we not value research. Unlike developed countries like America, the National Institute of Health, every year, gives money, gives funds, gives grants to research globally. And in Nigeria, we do not have any organ that gives grants, except TEFOND. And TEFOND excludes even NIMA because they say NIMA is not an education institution. Again, that is another story because I don't see how a research institute cannot be an education institute because it's resident in the Federal Ministry of Health. So many things are not right, but the truth is that NIMA has the capacity. And you see, capacity will keep on being built. You cannot just build capacity and be static. We have to be dynamic. And that's what NIMA is doing. I believe that if NIMA is supported, by government and private sector, because when we talk about research, it's not just government, it's also private sector, the philanthropists. People who spend money on valueless things and neglect what would help Nigerians to grow and develop. I believe that NIMA is doing the best it can within the circumstances it finds itself, and it should be supported. It should be supported with funds. And you see, you have to have what we call peer review mechanism. NIMA has to go places, send people out for training, and people coming in. I know that while I was in NIMA, we had collaborative effort with Emory University. We have a Nigerian who is in the University of Emory, and he had supported many of our trainings. Even when I left, the process continued because that foundation had been laid. We got grants from National Institute of Health in huge number, in huge amount, but we do not have any organ in Nigeria. And the Nigeria government should quickly put an organ. The National Research and Research, I think it's innovative, and innovation. Research innovation in Nigeria should be put in place so that it can function the way it should. We should have a granting body, in Nigeria, not just for health, but for other research institutes. And I believe that once that is done, Nigerians can up their game. They can match with any other group in this world. So the answer to your question is that NIMA is not playing a catch-up. NIMA is a moribund because it doesn't have funds to do what it's supposed to do.
Most certainly, those issues that you have raised, Prof, are significant, and we can only hope and expect that, as you said, the right things will be done, especially given that, it's an existential threat, so to speak. Health, is wealth, as we began with, and we want this wealth to increase. Professor Innocent Uja, President, Nigeria Medical Association, thank you so much for your time and thoughts this morning.